Hi, everybody. I think we're going to get started now. I want to welcome everyone here and the panelists who I'll introduce in a second, but welcome to all of you to the actually first of a two-part series on police reform. This series is sponsored by the Graduate Center Office of Public Programs, the Institute for State and Local Governance, and the Center for Urban Research. I'm Michael Jacobson. I'll be the moderator tonight. I'm the director of the Institute for State and Local Governance at CUNY and also a professor in the sociology program of the Graduate Center. So for this, I'm going to give 1 minute of introductory remarks and then quickly introduce the panelists and get this going. We have exactly 60 minutes and we have to fit a lot of conversation and questions in there. This particular panel is on sort of broad notions of community safety, how we define and think about community safety, public safety to some, the role of enforcement, policing, civil society, community, other governmental organizations to provide safety, always, of course, in the context of race and racism in America. The next panel a week from today will be a more try to address the question, what is to be done very specifically, largely flowing from some of the discussion in this panel. So let's get going. I'm going to introduce the panelists quickly in the order that they'll talk, and then I'll turn it over to them. So we'll start out with Jennifer Jones Austin. Jennifer is the CEO and executive director of the Federation of Protestant Welfare Agencies, which is an anti-poverty policy and advocacy nonprofit. She's also the chair of the New York City Board of Correction, a chair and member of the New York City Racial Justice Commission, tasked with dismantling institutional racism across New York City, and a co-sponsor of the NYPD Reform and Reinvention Collaborative. Following Jennifer, we'll have Dr. Ashwin Vasan, who's the president and CEO of Fountain House, which is a national not-for-profit dedicated to improving health and increasing opportunity for people with serious mental illness. Ashwin is a practicing physician and academic and is an assistant professor at the Mailman School of Public Health at Columbia. He's also worked at the World Health Organization and was the director of Health Access Equity at the Department of Health and Mental Hygiene here in New York City. The next speaker will be Maureen McGough, who's the chief of staff for the policing project at NYU. She oversees their national effort to increase transparency and accountability in policing and reimagining public safety, all obviously germane to what we're talking about here. She spent a decade at the U.S. Department of Justice, along with the Department of State, and was also a senior advisor at the National Institute of Justice on evidence-based policing, system and legal reform. Finally, we'll have Chief Rodney Harrison, who's the chief of the department at NYPD, overseeing all the uniform functions of the agency. Chief Harrison started as a police cadet in 1991, and I believe he's the first police cadet ever to reach the rank of chief of the department. He's held every rank in the agency, from police officer to bureau chief, including detective. He's worked in all 5 boroughs and has commanded the 2-8 and 3-2 precincts, both in Harlem. So they have much longer, more impressive bios than that. I encourage you to look at them on the web, but we need to get this going. So I'll turn it over to you, Jennifer, to kick us off.
Looks like I'm muted. All right, I'm good to go. Sorry about that. I want to thank you all for having me this evening and for the opportunity to join in conversation with this illustrious panel. I'm going to learn a lot tonight, I'm certain of it. Let me begin by saying that for me, community safety is about feeling safe wherever you are, and especially in your own neighborhood. It's about quality of life and being able to access and secure the most simplest of everyday basic needs and experiences, whether it be personal, professional, social, or economic. And all of that without fear or actually being subjected to crime or to abuse and excessive use of force at the hands of your local police. For some, community safety is a norm, and for others, particularly persons of color residing in low-income neighborhoods, it's a pipe dream at best. And for those others, those persons of color residing in low-income communities, we cannot even begin to envision or conceive of community safety without first addressing the system that has long deprived them, has long deprived us intentionally and by design of community safety. And that's the system, as I see it, the system of racism, capitalism, and militarism or militarization, all working to continually oppress people of color. Here in America, it's long been the case since the founding of our nation that racism and militarization have been used as tools to reinforce a capitalist society where some have and are entitled to have, and some do not and aren't entitled. Here in America, racially and ethnically concentrated areas of poverty, ghettos, as we used to refer to them, but I guess it's no longer politically correct. Ghettos were created and starved of vital resources from quality schools and hospitals to safe and affordable housing, parks with lush green grass and trees, and capital to grow and sustain thriving local businesses and economies, all to reinforce a racist narrative that people of color, Black and brown people, are lazy, animalistic, and abhorrent with vile and incorrigible behaviors that must, and for those reasons, they've got to be sectioned off and over surveilled to keep the rest of our society safe. And so it is today here in New York City, in the community districts with the highest concentration of low-income people of color, that we have, for the most part, save one or two, the community districts with the highest rates of arrest and incarceration. Community safety for some is a norm, and for others, particularly low-income people of color, residing in neighborhoods that are concentrated with low-income people of color, it's a pipe dream at best, and it's largely due to structural racism. So what can we do about it? How do we achieve community safety for all? You know, some would say the answer is simple, but actually doing the work is what's much more complicated, much more complex. We first got to name and dismantle the structurally racist systems that intentionally marginalize and deprive persons and communities of color of basic goods and resources. And then we have to also dismantle the deliberate oppressive militaristic forces that saturate these neighborhoods. Now, I'm not advocating for the defunding of the police in its entirety, but what I am saying is that we've got to realize that what this is all about is racism at its core. And the police are but one aspect, because we have deprived and withheld, marginalized these communities and these people by giving them the basic resources that they need to survive. So the response is not just to go after the police, but it's also to address and come up with a multi-sector response that looks at what we have to do by way of restorative justice, not just for people, but for communities of color, and restoring or creating the systems within these communities, the health systems, the education systems, the local economies that will create thriving neighborhoods and thereby bring about community safety. So for me, it's not just about policing. It's the whole kit and caboodle, because it's all tied to racism in every pillar of our society and these constructed neighborhoods where essentially we have sectioned off low-income people and determined that they are less than and therefore can be deprived of these basic resources and treated inhumanely by institutions that are supposedly there to keep us safe. It's a collective, collaborative approach.
Thank you, Jennifer. Ashwin?
Thanks, Jennifer. Thanks, everyone. Thanks to the distinguished panel. It's great to be here. Hope you can hear me okay. So I'm often invited to these sorts of panels as the doctor and the epidemiologist to talk about X as a public health issue, housing as a public health issue. And in this case, let's look at community safety and policing as a public health issue. So what do we mean by that? I'm a primary care physician. I'm an epidemiologist. and I focus on the health, both of individuals in my role as a doctor, but really of populations and communities. And my rigorous focus is on saving lives and improving the quality of life for everyone. So from the public health perspective, we think about illnesses or disease states or health as a series of things that are driven by risks, by exposures, and that lead to outcomes. And the work of public health is about modifying risks in the community, modulating or mitigating exposures with the hope that it improves health and social outcomes. So let's use cancer for an example, right? There are certainly individual level risks to developing cancer. Those might be inherited sometimes. Those might be related to age or gender. But these are basically, in many cases, immodifiable aspects of you as an individual that might, by definition, place you at increased risk of developing a health condition. Then there are exposures, the modifiable things we're faced with on a daily basis that can lead to increased risk and development of illness and disease. In the case of cancer, it might be toxins in your food, it might be environmental toxins in the air or the water, it might be tobacco use, it might be excessive drinking, and so forth. And then, of course, there are outcomes, right? Disease states of ill health, of ill well-being. That's the focus of our public health efforts to save lives and to improve quality of life. So how do we describe policing in this context? How do we describe this system that we've created in the context of public health programs that are about controlling our risks and improving outcomes? Well, make no mistake, police is an exposure. The state of policing, like any other social or administrative system, is entirely under our control, and it's of our own design. We made it, we can remake it. And make no mistake, in certain situations, it can save lives, right? If I want to have access to someone to come help me if I or my children or my family are in trouble. But it can also lead to wide-ranging and entirely preventable health effects, mental health effects, and trauma. Let's look at the narrow issue of mental health crisis. 1 out of 4 people killed in police encounters suffer from mental illness. This is true in New York, it's true in the nation. In New York City, 16 out of the 18 people who have been killed over the last 5 years with mental illness have been people of color. What about chronic trauma? What about the daily witnessing of police interactions, often negative, and the mindset and the mental health that evokes over time? We talk about that as allostatic load in the public health literature, right? The constant and cumulative effect of stress, of raising your stress hormones, of increasing blood pressure over time on mental and physical health. But these are wide-ranging impacts of policing on things like mental health. A 2018 study from The Lancet looked at the spillover impacts on mental health in the Black community of police killings of unarmed Black men, right? With each killing adding upwards of 20% of additional poor mental health days to people that had no connection to the event, either family or community member, but people who are aware of it through the news reports, through social media. Just the idea that someone unarmed, a person of color, could be killed at the hands of police was distressing enough to people to have an impact on their mental health. So we could go on, and there's a lot of data behind mostly mental health conditions, but also physical health conditions and the impact of policing. But as we think about a public health approach, in order to save lives, we have to have a conversation, of course, about how to modify an exposure, right? So that means, of course, we talk about modifying police practices, but we also need to be talking about what are the things we need to build and what are the things we need to invest in order to make communities truly safe and, by extension, healthier. How do we save lives not only by changing the fundamental nature of police interactions, but by reducing their need and their likelihood and their targeting in the way that Jennifer just described, certain communities exposed to the structure of policing disproportionately than others. What are the things we also need to build in its stead? How do we fundamentally change the nature of the way that we respond to 911 calls for mentally ill people? The work the city has begun and the country will have to begin and has already led the way on with the advent of the 988 suicide prevention hotline, the federal hotline in 2022 is a start. What about our failing mental health system as a whole? 280,000 people live with serious chronic mental illness in New York City. 40% of them have no access to care at all. What are the community and social and care infrastructure that is available to them? That isn't incarceration, that isn't institutionalization by default, but that actually offers them up support, connection, community, opportunity, and health. What about isolation and disconnection? These are hallmarks of mental illness that drive people into crisis. What are we doing to make people feel more connected in their communities and to their city and other communities? And of course, what are we doing for basic risks like housing and the quality of our educational systems, income inequality, and access to capital? These are all social determinants of health that, whether near or far, have an impact on your risk of encountering the police in a particular way. And add on that layer of structural racism that Jennifer so pointedly called out. And we have a series of modifiable things that we can do to save lives. If we want to, it's not enough to just call this a public health approach and to say that we're interested in health and trauma and mental health. We need to approach it like a public health program and diagnose what are the modifiable things we can change. What are the things that are under our control? Policing is one of them. But as Jennifer rightly said, there's a whole lot of other things layered on top, and we have to be pushing in multiple directions at once. So I'm eager for the discussion.
Thank you, Ashwin. Maureen?
Thank you so much. I really appreciate the opportunity to be here and have this critical conversation. I think historically conversations around safety have really centered on the protection aspect of the word. So largely focusing on the coercive authority of the state, but there has been an ever-growing acknowledgement, as is reflected by the previous panelists' comments, especially with regard to prevention activities, that the community can and should play an outsized role in achieving safety outcomes. And importantly, we as a society tend to significantly over-rely on that coercive authority to solve what are inherently social problems. It fails to address the underlying problems and in many cases actually exacerbates them. One of our highest priorities at the Policing Project, particularly in the wake of the murder of George Floyd, is around reimagining public safety systems. We have a series of research and pilot programs where we've engaged a multidisciplinary group of researchers, community advocates, police leaders, behavioral health specialists, municipal leadership, the list goes on, to help jurisdictions understand what is it that their police currently do, what is it that their communities actually need with regard to safety services, particularly around things like first response, and then how best you collaboratively redesign a system across disciplines that centers community needs and elevates community-based solutions. And the fundamental question that we've had to grapple with in doing this work is the very question that we're discussing today. What is safety? It seems a little bit esoteric, but it's really critical to nail down when you're talking about redesigning the entire systems that support it. We're in the middle of these national forums and jurisdiction level focus groups, individual interviews with the primary goal of understanding what are community perspectives of safety needs, what are their priorities, and how do communities think those safety needs should be met. And it will come as no surprise, particularly given the comments that you've already heard today, almost to a one, particularly at that jurisdictional level in the conversation, when we ask individuals about their public safety needs, people name things that have nothing to do with criminal justice and everything to do with social determinants of health. What are your safety needs? We need economic mobility, opportunities for lawful gainful employment, access to reliable transportation so we can get to those jobs. We need a good education so that we're prepared to enter that workforce. We need affordable, stable housing, food security, and the list goes on. I should say, if this is an area that you're interested in, our founder, Barry Friedman at the Policing Project, recently released an article called "What is Public Safety?" that actually gets into those intersections very deeply. And it's a great read if you're interested in learning more. Those factors make imminent sense as safety issues, and I'm sure it's not a surprise to anyone who's attending the panel today, but it is really daunting when you're seeking to understand those factors for the purposes of redesigning a system to address them. You know, it's one thing to talk about public safety and traditional notions of the criminal justice system, but it's something entirely different to say we're looking at redesigning a system that covers everything from housing to transportation to education, not to mention crime. It's not long before you're sort of tackling redesigning society as a whole, which isn't feasible or realistic and is a horrible place to start. So what we've recently started doing at the Policing Project is to try and establish a reasonable bound on what it is we're talking about when we're talking about safety systems. And we're actually turning to public health and their prevention framework to do that. And it's a little bit intimidating talking about a public health framework after Dr. Vasan has spoken. So feel free to jump in and correct me if I'm getting any of this not quite exactly right. But in public health, there's really sort of three main levels of prevention. You have your tertiary prevention, and that's where the disease is established and you're trying to treat it and minimize lasting effects. The analogy here in criminal justice would be police responding to gang violence, for example. You've got secondary prevention, and that's where the disease has already started to take hold, but it isn't quite symptomatic yet. That would be an analog of after-school interventions for at-risk youth who are at risk of gang joining. And then you have primary prevention, and that's where you implement a broad-based intervention before there's any evidence of disease or injury. So in public health, that would be an education campaign around exercising and eating a healthy diet. In the sort of safety context, that might be drawing new business to the jurisdiction to increase employment opportunities for all residents so that they're less likely to fall on hard economic times. For our work in jurisdictions, we're actually drawing the line as to what's relevant for a safety system in between that secondary and primary prevention space. So that tertiary level, figuring out the best way to respond to crime and safety incidents that have occurred, that's definitely in. That secondary level, figuring out the best way to prevent crime and safety incidents with specific individuals who are at risk, that's in. But once we start expanding to addressing those causal factors that impact safety, that's where we usually draw the line, though I imagine there will be some exceptions to that rule as we continue to build in all of the jurisdictions across the country that we're working in. One note I want to make at the end here, particularly right before we transition to the chief, is that I just want to bring it in a little bit because it's very easy to talk through the expanded lens. But as we work towards actionable solutions, I think it's really important to understand the complexity of community perspectives on the role of police in helping to achieve public safety outcomes. Of course, there's the really well-known traction around shifting funds away from police and investing in alternative social systems that might better address underlying needs. But it's not necessarily that simple. And one of the things we've seen in the conversations that we're having, particularly with community leaders, is that there's a huge range of perspectives about the role of police in communities. And I don't think that nuance necessarily shows up in a lot of the national conversations. But for example, we recently had a focus group of community leaders in a major metro area that has experienced several high-profile instances of police violence recently. And there was some conversation of things like defund and abolish, but there was just as much conversation of things like, if you want to hear our elders go off, speak abolish. Or I live in a particularly violent area of the city where there are a lot of shootings and gang violence. I don't necessarily want fewer police. I just want better police, and I want them to stop killing us. So I just want to throw that nuance in there as we sort of think about what community safety is, because I think it's sort of inextricably linked to our evolving notion of what police could and should be doing to achieve public safety outcomes in communities.
Thank you, Maureen. Okay, Chief, you want to take us home?
Yeah, Mike, good evening. Thank you so much for having me. And, I really took in a lot of the words that the other people of the panel stated. And it was very interesting and intriguing. And it's kind of going to allow me to flow into talking about some of the statistics that we see here in the NYPD. So the first thing, before I get started, I have 30 years in the police department. I'm gonna need for everybody to at least give me a chance and trust me. That's the first thing I'm gonna ask. So just take a look at New York City for 2021 and the spike in violence that we've seen throughout this year. And it's, unless you've been living underneath a rock, I'm sure everybody knows that in New York City, we're struggling with a lot of violence. And just take a look at 2019, we had 789 shooting incidents. To me, that's a successful year regarding trying to keep violence down in arguably, or not even arguably, the biggest city in the country. So if I could just take a look at the start of 2020 from January 1st to March 1st, that was kind of the couple of months before COVID hit us. We only had 115 shooting incidents. After COVID hit us, right before the George Floyd incident, we had 192 shooting incidents. So that's one layer that where we saw a little bit of a struggle in the violence. And the spike in shootings during that COVID area timeframe was 192 versus 161. And then when the George Floyd incident occurred, and it was a very unfortunate incident, and it definitely has set us back as a public safety organization. From May 25th, when the George Floyd incident occurred, to December 31st, New York City had 1,244 shooting incidents. Ladies and gentlemen, that's compared to 528 the year before. So you just got to take a look at the couple of layers that have happened where we've seen the spike. COVID hurt us, where everything shut down. The George Floyd incident that happened halfway across the country really hurt us regarding having those strong relationships that we built up going into 2018 and 2019. So what's the difference? What changed in that time frame? And it turned into like a perfect storm. And you know, one thing about the NYPD, at least myself, I don't want to ever make excuses about legislative changes, but certain things have really had an effect on us. One of them being bail reform. Bail reform started in January 1st of 2020. Then we could talk about the discovery law. If you don't know what the discovery law is, that also came out in January of 2020 as well, where if somebody was a witness or a victim, that information has to be turned over to the defense attorney. Anybody gives information to a defense attorney, I'm sure we all can understand that information could easily go to the wrong person, where we lost a lot of trust and people feeling uncomfortable coming forward. Take a look at our gun arrest. This year, we have 3,560 gun arrests. Only 41 individuals have gone to jail. That's in contrast to 601 individuals that have gone to arrest back in 2018. So now there's all these factors that are going along in place, as well as there's no accountability for people carrying illegal firearms. The comfort level that we're seeing with people carrying firearms this year is astonishing, as well as disturbing. We've seen a big increase in gang and crews pretty much recruiting more individuals to join their gangs. A lot of gang violence is going back and forth, especially this thing called drill rap on YouTube, where they're antagonizing one another and going back with gun violence to retaliate. That's a major problem. So let me read you some names that people maybe have heard of before. DeVell Gardner, Brandon Hendricks, Bertha Arriga, Priscilla Vasquez, and most recently, a woman by the name of DeAndre Reed. DeAndre Reed was shot yesterday in East New York in the 7-5 precinct. She was working at a homeless shelter, helping feed the homeless individuals in that community, and on her way home, got shot in the head. And let me read you some of the numbers regarding our youth violence. Over 35% of our shooting incidents involves youth. And we've seen 60% increase in youth carrying guns. Over 30% of these youth have had a prior gun history. Youth gangs and crews are accounting for a large proportion of the violence that we're seeing in New York City. So I just take a look at what the NYPD is doing regarding the youth. This is very, very important to us. This is something that we've now prioritized because we've seen the youth violence really stir up a lot of the issues in 2020 and 2021. We have a youth coordination bureau now that oversees our youth coordination officers. We have a Blue Chips program where we have officers assigned to each precinct working with youth in their community to make sure we're teaching them the game of basketball, but yet at the same time, making sure we mentor them and sustain that mentorship so we can gear them in the right direction. We have an options program where we're teaching kids real life situations and scenarios so they don't make the wrong turns. We have something in the Rockaways, it's called the Rockaway Cults, where we have officers assigned to the Rockaway community, kids that are in middle school and high school, teaching them football, but working with the Department of Education and gearing them in the right direction to do good in school, but yet at the same time, teach them a skill set in sports. We have a community center in East New York, 127 Pennsylvania Avenue, where we have aeronautics classes for men and women that live in that community, teaching them to maybe learn how to fly a plane. So there's so many things that we're doing from this organization outside of just making arrests. We are doing the holistic approach that unfortunately sometimes doesn't go that far. And then people are always wondering, like, how are these guns get into these young men and women's hands? And that's always been a problem. And we've strengthened our relationship with ATF. If you haven't seen, we did a great takedown in the Bronx the other day with a lot of these ghost guns where we got 80 ghost gun firearms off the street.
Maybe just one more minute, Chief. Is that okay?
Yep, that's fine.
Okay.
We're doing gun buybacks all the time. We're asking for gun stop tips. So if anybody knows anybody that has a legal firearm, you can be compensated regarding having that gun turned over. So we're doing a lot of different things that are going to make this a safer city, but we also understand we can't do it by ourselves. We need the community's help. We need to make sure we work together to bring the violence down that we've seen in 2020 as well as 2021. Thank you.
Thank you, Chief. So just a quick note for the audience, if anyone's interested in asking questions, maybe by about 8:10 or so, you can start putting your questions in the chat, and we'll try to get to as many of them as we can. But before we get that, I mean, I not surprisingly have a whole series of questions I could ask all of you based on all your sort of thoughtful talks. But I wanted to give, before I did that, do any of you have, based on what your fellow panelists have said, have questions for each other, either about one of the specific presentations or just thematically? I don't want to jump in if you folks have questions yourself.
I have one question, and first I do want to express my appreciation to all the panelists for what they've shared thus far. For Chief Harrison, I do have one question centering on bail reform. So when we begin to see a spike in criminal activity, we heard immediately that it was due to bail reform. But I have yet to see, and I don't know if I'm just looking in the wrong places, where they've been able to draw this direct correlation between bail reform, persons having gotten out of jail or not having gone to jail, and then having committed one crime after next, like a significant number that would suggest that this is really what is causing this spike or is a significant contributor. So if there's data that you can provide, or there's a resource that you can provide for that, because the concern is that, you know, that bail reform is not embraced and it's not appreciated, and it's being used as a kind of a scapegoat, you know, or gaslighted, if you will, you know, by the police department, and that it's not really the case that bail reform is the cause of the spike, in part.
So absolutely, I could definitely share some data with you. Listen, I could give you experiences or things that I've seen in my position as the chief of department. I don't want to take up too much time in the conversation. Maybe we could talk offline, but I didn't say that it's only bail reform. I was saying that it's one of the layers that we've seen that it made a major struggle in some of the violence that unfortunately that now we have to try to deal with in the NYPD. And once again, is this, we want to work with the community. We want to find ways to make things better. And if there's a holistic approach we can do, then we're all in. But unfortunately, too often, we've seen incidents where people are committing acts of violence, coming out due to the legislation and committing acts over and over again. So, but I'll get you that data as quickly as possible.
I appreciate that. Thank you.
So Ashwin, Maureen, I'm happy to jump in. I just want to make sure I'm not keeping you from asking anything of the chief. So here, I guess one of my, and the chief mentioned this, you know, in the context of, and this isn't just a New York City issue, obviously there's in the last over a year or so, there's been a nationwide increase in homicides and shootings. That increase is slowing nationally year to year. So that's I mean, it's not great news, but it's good news. But it has created a very different context for some of these discussions, the things that Maureen and Ashwin and you, Jennifer, have been talking about, right? Because crime now, and it's not like it's not been a real increase, right? There are all sorts of debates about what led to it, how long it'll last, is it temporary, is it a blip, you know, but it's real nonetheless. And it's not just a substantive issue, it's a political issue, right? And when crime becomes a political issue, usually the rule is no good can come of that. So, I mean, especially for Jennifer, Ashwin, and Maureen, I mean, how does that color some of the things you've been talking about, right? This is it's sort of a different context to some of this discussion now than it was you know, before all the talk and all the both real and media frenzy about this increase in crime. Does that make these discussions about community safety and sort of aspirational issues more difficult in the sort of real politique context of crime increase or not? I'd love to hear any of your thoughts on that.
Yeah, so Mike, I and you know, I think it was Maureen that stated, you know, what makes something safe, or what are the safety needs. We in the NYPD, we take a look at certain crimes that occur, everything from murder down to rape, down to robbery, down to felony assaults, down to grand larcenies, down to stolen vehicles, GLAs. But we also take a close look at shooting incidents. And like, the numbers don't lie. I mean, it's not a political engine we're trying to jump on. We're not sitting here and saying, hey, these things have happened and this is why the numbers are where we're at. Listen, if it was up to us, we don't want anybody ever shot. That's the last thing we want to see. And the truth of the matter is, Mike, it's my community where we're seeing the violence. The communities that look like me, where we're seeing the major spikes, the East New Yorks, the Brownsville, Brooklyns, the Highlands in the Bronx, Sound Views. Those are Harlem, New York. These are my communities where my family lives, where we're seeing the violence. So there's no political agenda here. We want to do what we have to do to stop the violence. And unfortunately, it's a small percentage, very, very small percentage, but that small percentage has caused a humongous spike in shooting incidents. And once again, is this, we too often, unintended individuals, mother walking home after work, a woman going shopping, a young lady on a bench on her phone. Too often we're seeing unintended individuals being victims of shooting. And it's happening in the communities of color, which is extremely, extremely alarming. And we unfortunately have to put our enforcement, our deployment strategies in those areas that are vulnerable.
But if I can just jump, oh, I'm sorry.
No, go ahead. Go ahead. So Jennifer and then Ashwin.
Well, and Ashwin will probably be better able to articulate this, articulate what I'm about to say. But just as he talked about the social determinants of health, there are social determinants of violence. And we know that in a society such as ours, where we have deprived people of basic resources, speaking to their economic, social, and emotional well-being, we know, there's research that speaks to the adverse childhood experiences that tie in with poverty, that tie in with issues related to, impoverished parents. Incarcerated parents, domestic violence, that it's all intergenerational. And a lot of this is what stems the violence. We know that in America, that a great percentage of crimes are attributed to poverty. And so in a COVID world, where people have been deprived of basic resources, where you have people that have suffered the stresses and trauma attended to extensive loss of life, loss of livelihood, loss of the ability to thrive in environments that that center on their well-being, you're going to see these stressors, and stressors often play out with respect to violence, or in connection with violence. Coping mechanisms are not at play, and the supports aren't there. And so it's all intersectional. It's not just that you have people in low-income communities doing bad things, feeding the narrative that has long existed, that if you're a low income and you live in a low income community and you're of color, then you're more likely to do bad things. No, it's the societal structures that make it so.
Ashwin?
Yeah, that was very well said, Jennifer. If you think about recovery back to, let's say, the halcyon days of the statistics that the chief put out before 2019 or 2018, you think about sort of three things in the context now of the pandemic. Are people actually safe from the pandemic? Can they move around? Are they going to get the illness? Is the vaccine immunity waning? All of those questions that are still circulating in the zeitgeist. Do people feel safe? Do they feel like they can walk around and contribute and connect and engage with their community in healthy ways? And do they have the freedom and economic security to do so? When we talk about recovery, those are three pretty core principles that end up intersecting with all of the things that we've talked about here today, social determinants of health and so forth. And what I don't hear enough of in the conversation is how those three things are working together. How is police and public health and economic recovery and the city's economic agencies at a table crafting that strategy together? Because it's fine to be thinking about this in a reactive way, but it's only going to get you so far. If we're, I think the the potential mayor-elect to be constantly uses the Desmond Tutu quote of, not going further upstream to prevent people from falling into the river in the first place. Well, I think the chief would even agree that a lot of what we're doing in response to this spike in violence is the pulling people out of the river, right? It's at the downstream end of just reacting and putting a Band-Aid on it. And what I'd love to see in our conversation is the kind of the end to false choices, the end to the idea that, well, this exists on two tracks. One's long-term structural change and the other's right now. Well, why aren't we redoubling our efforts on some of those structural drivers while we are coming up with creative police strategies why isn't this to address the spike in violence? Why isn't this a yes and conversation rather than what is often pitted as an either or? And so either people calling for structural reform are Pollyannish and naive, and the people calling for more policing and safety are narrow-minded and brutal, or whatever adjectives we want to use. That's a falsely pitted narrative that we have to get beyond, right? If we're going to see any sort of change, otherwise we're going to be pitted in this circular firing squad that we're currently in. And so I would love to see us actually have, if we're truly treating these things as intersectional and we're truly treating these things as holistic, let's have all of those cards on the table talking about that in one fell swoop. Because right now these conversations are siloed. And so it presents to the people of New York City and to the American people a set of choices. Like, you're either for policing or you're for community investment. I'm for both, better on both. And we need to really advance a conversation where public health and smart, efficient, right-sized, quality policing is advanced in concert with one another.
And Maureen, can I ask you to respond to that as well?
Just a hearty +1. I feel like Ashwin made all the points that I wanted to make, but I think, one thing that's really important to acknowledge is I think part of what we're trying to do is actually relieve policing agencies from the burden of prevention in addition to response, because that they're not particularly well suited for that on the broad scale. Now that we understand sort of the drivers of violent crime, it's beyond the purview of a policing agency. And what we're trying to do is have other actors come to the table and pick up some of that responsibility. In all of the community conversations we've had, the value of police in responding to violent crime has been addressed and welcomed by many members of the community. But the role of police in preventing it and building community resilience and creating those opportunities is questionable to folks. So I think it's really about sort of right-sizing our public systems so that they adequately address sort of aces in their places, what agencies are good at, and the resilience that they're able to build in communities, give them the latitude to do that work while police are also responding to violent crime as it occurs.
Thanks. So, well, I have more, but I'll sublimate mine to some of the audiences because the questions are coming in now, and some of them are very sort of specific questions. Some of them are a bit larger in scale. So maybe I'll start off with a specific one that's directed to you, Chief, from Cassidy, who's asking, when you go and you talked about doing this to build relationships with communities, what is the process for identifying the leaders in those communities to have the kind of conversations you're talking about? Who are community leaders? How do you determine who that is? And then how do you start to have discussions with them?
So in 2015, we came up with neighborhood policing. Neighborhood policing was a dynamic way of how do we protect this city. And the concept was having certain officers in the same areas every single day. And with that came is an intimacy, a relationship, knowing the business owner, knowing the clergy, knowing the residents, knowing the individuals that were part of a block watch, whatever the case may be. So we never said, hey, we're gonna make this person the important person in the community. We just want to strengthen those relationships and make sure we identified issues together and make sure we work together as a team to assist in solving some of the problems that we've seen in the different communities. Now, everybody has to understand this. Some of the issues that you may see in East New York, you're not going to have the same issues in Bayside, Queens. So each part of the city, you have to establish those quality officers, assign them to the certain communities, and make sure there's a synergy and dialogue to work together to say, hey, listen, this is how we're going to fix this issue. If it's violence, we're going to work this way to get violence. If it's going to get individuals some type of social assistance, then so be it. If it's a quality of life concern, then let's do it together regarding how we're going to fix the quality of life concerns. But the NYPD, we want the information to come to us so we can resolve them a lot faster. If there's somebody that wants to raise their hand and say, well, listen, I'll be that leader in the community that will bring the information to that officer or to that neighborhood coordination officer, then we'll gravitate to that person. If it happens to be a group of individuals, then we'll gravitate to that group of individuals. But the most important thing that everybody has to understand, in order for us to be successful, we have to have strong relationships with the community that we're here to protect and serve. Hopefully I was able to answer that question.
Thanks, Chief.
Yeah, can I just add?
Yeah, go ahead. Go get in there, Jennifer.
I just want to, I very much appreciate what the chief is saying, and I don't disagree with the chief, but I must say that I think we have to begin with this, examining the question of what policing and community safety looks like and what it means. Just as Chief Harrison talked about, Bayside looking different than does East New York. Community safety and policing looks very different in each of the communities, not just based on what is required, but based on the mindset of the police officers who go into those communities and police those communities. In the more affluent communities in New York City, the police are walking in with, we're here to keep people safe. In many of our communities, low-income communities with people of color and, and high levels of crime and arrest and incarceration, police, whether they own it or not, are beginning with this is a war zone. And you know what? Like those who are victimized are as much the perpetrators of the crimes. It's a different mindset. And if we don't own that and own the origins of that, we're not getting beyond that. And I'm not, what I should say to you, Chief Harrison, is I'm not picking on the police, because just as that's the case with policing, it's the same situation with education. It's the same situation as it concerns healthcare. It's not just in policing. It's in every pillar of our society that, persons who are white and are affluent, they're the ones that we are here to serve, save, and protect. And those who are not are deemed heathen and less than worthy and less than valuable. And so the mindset and the orientation, it's proven, of the educator, the physician, save my good friend, Dr. Vasan, of the police officer. It's the same mindset, because we're all living in a racist society and we've been conditioned to think this way. It's important to know that.
No, thank you, Jennifer. And Chief, I want to ask you to respond to that, but maybe before, can I ask you, Maureen, the dynamic that Jennifer was just talking about, sort of the different context of policing and how it's viewed in affluent communities versus lower income communities. Is that something you see in your work around the country?
So it is, and that dynamic is particularly important to consider as we think through redesign systems. So one of the things that we're actually researching right now at the Policing Project is trying to establish a more rigorous evidence base around decision-making at the time of dispatch. So there's a lot of traction now for alternative response models, for example. Perhaps it's a non-police response, or perhaps it's sending a mental health provider alongside of police, but that decision is going to have to be made at the time of the call. And without a stronger evidence base around call taking and dispatching, it's going to be a lot of subjective decision making. And we're really sort of worried about the fact that disparate impacts will perpetuate, and white communities will be the communities that are receiving the alternative response model, and Black communities and other communities of color will continue to receive police responses. So jurisdictions that are implementing these as perhaps a fix to some of the disparate impacts that we're seeing, where we're not particularly optimistic that simply by adding an alternative response model, you'll get to equitable outcomes.
Thanks. And Chief, I want to, if you want to respond to any of this, please do.
Yep. So I just want to, I know Jennifer used the word, I'm going to politely disagree. She used the word and said we, as a police department, go into certain communities as a war zone. We don't do that. We go into those communities and say, how can we help make this a safer area, a safer community? If you take a look at certain communities throughout the city, and I was going to read off some numbers, but I don't want to get too caught up into the numbers. But we know where we're struggling with some of the violence. Yes, the officers may be a little bit more proactive because there's a lot more guns that are shooting people more frequently than in other communities. So I think we're not on the same page when it comes to safety. Safety to me is people not being shot. I know there's a part about resources and things of that nature and making sure we're assisting and getting our low-income communities the assistance that they need. But we're here for public safety. And with public safety, we want to make sure that when anybody that's on their way, traveling home, headed to work, going to school, my most important thing is that they get there safely. And fortunately, in certain communities, yes, there are a lot more elements of violence that we need to address in contrast to others. I wish it wasn't the case. It is what it is. It's a balancing act, but we want to make sure that we arm our police officers with the appropriate knowledge of how to treat every single community with the level of respect that we've been doing since we created neighborhood policing.
Right. So I know we're bumping right up against time, but I do want to get this, and then we're going to get cut off at some point, right in the middle of this. But there's actually a question from Andrew Carbon, who's a professor at John Jay, and he says it's for the chief, but it actually really could be for anyone. And he's asking, he described some NYPD prevention programs for at-risk youth that teach them how to fly a plane or be a better athlete or student. And the question is, aren't these the kind of prevention programs that are the sorts of things that should be removed from the police and given to neighborhood-based groups to do? Like, is that an example, forgetting about how relevant or good they are, but is that something the police should be doing, or should civil society groups be doing that? And it's obviously a question for the chief, but anyone can really answer that. And I guess that's under the umbrella of sort of disinvest and reinvest. But what do you think? That's a reasonable question, Chief? Is that something the PD should be doing versus other agencies or groups?
Well, I'm not going to sit here and say that we should not be doing it. I think it's important that the people that we're here to protect and serve see the human side of us. They see that we're not this moving army that's here to be militaristic and just come in and take over a community. They need to see the human side of us. They need to see we're here to help. We're here to work with the youth. We're here to do things of mentoring. Yes, we can share that with other organizations as well. And we do that. We work with PALs and a host of other grassroots organizations throughout the city. But isn't it better for community residents to see a New York City police officer play basketball with their children, or teach them aeronautics, or teach them how to do a resume for college? These are the things that people don't understand that we've been doing. We've been doing it for quite a while now that I don't think we promote or pop our collar about, but there's a lot of things that, yeah, other people can do, but we want to show as an NYPD, we're not just here to fight crime. There's a community component that we want to be able to work and make sure that people understand that we're here to build trust as well. And when we build trust, we become a safer city.
Thank you, Chief. Well, we're 1 minute over, and I know I'm on thin ice here, but I did want to say before we close out to really thank the panelists for a really excellent, thoughtful discussion. Thank you so much for doing this and being involved as you are, not just in the issues, but for coming here and doing this. It's been a great discussion, and thank you to the audience. You asked, there were a series of great questions here. If we had another couple of hours, we could have gotten to all of them, but thank you so much for coming, and hopefully we'll see you in a week the next time, and thanks to all of you again.